So with that live update straight from Russia's capital, Moscow. Thank you, Julia, for being with us here on the broadcast on WION World is One. Time now to get back to that Chinese government media briefing that is continuing as we speak. Let's listen in and understand more.
So as to, supply enough medical equipment. So that's a very effective way. And also, for this purpose, we have come out with this guideline for medical workers, to tell our medical workers how to deal with the situation, the sequence to wear this protective garment, because sequence is critical. So, during SARS or this outbreak of the new virus, you always have to wash your hands, because some people make the mistake of thinking that they are always safe once they put on this protective gear. But still, you have to wash your hands. So, we have to give better awareness to our medical workers by issuing these guidelines. Another thing which is also very important is to allow our medical workers to have enough rest. They're working very hard, and they're exhausted mentally, physically, and the immune system has in a low level, which make it easier for them to be infected and to fall ill. That's why in these designated areas where they treat these severe cases, we're putting a system where, these medical workers work in rotation, in turns. We have to make sure that they are in good shape, which is the only way, to make sure that they are productive, they are, fulfilling their missions as the frontline workers. Thank you. Science Technology Journal. Mr. Sun from the Biological Center. So development of the drugs are one important of your mandate. We have this remdesivir. So could you say a few words about this very important drug that's being talked a lot about online? Since the outbreak of the virus, development of the drug has been following 5 principles. And the development of the drug is one of these 5 principles. And primarily, to improve curity and reduce the fatality, this has been our guiding principle, of course, as known to everybody. Development of new drug is a lengthy process, time-consuming process, which means we cannot follow the tradition of this R&D to do our work. So most as organized experts try to make breakthrough based on our achievement, especially on the drugs that are already available or being tested in clinical trial, and we have to make sure they're safe. In the sense that we have to make sure that drugs are effective in curing this new virus. And a lot has been achieved on top of this drug. And also, we identified some TCM medicines. Which is a TCM drug that is already available. And they proved to be very effective in addressing this agent of the new virus. So we are using them for the clinical trial, and as well as for human and for animals. And this has shown that TCM is, to a certain extent, effective in addressing the patient. Of course, further work has to be done. About this remdesivir, we have been increasing international cooperation with other countries based on this in vitro systematic screening, and we put in place a new system architecture. And this drug has been used to cure AIDS, and the clinical trial has not been fully completed. But it showed a very good, it is very vital as part of the clinical trial. So we are doing this kind of clinical trial in 2 hospitals, and this drug is going to arrive this afternoon in Beijing, in China. And also, as part of the emergency projects with most, we're putting a lot of resources. The scientists, they will follow the patterns, the laws, scientific laws, and also they will use the dry cells as well as the blood oxygen saturation, and we hope that their efforts will bear fruit as soon as possible, especially to bring good news to our severe patients. So our R&D people, they have never relinquished their work, and they've been working very hard. As I said, much has been achieved, and we expect more to be achieved.
Okay, this gentleman from the 3rd row. Hi, thank you. I'm from China News. We noticed that in Hubei province and other regions, every day, in terms of new confirmed cases, the number is big. So based on current situation for Wuhan and other epidemic regions, do you think the fever clinic can address this challenge? And also, what kind of measures taken to receive more patients? Okay. As for fever clinic in China, we collect data among 31 provinces. We have 15,000 fever clinic. We have 2,092 designated hospitals. To understand the situation better, we know for fever clinic, in terms of the outpatients, number are very important, because we can research about the trends of this disease based on the research of the number of the patients. So we have the daily report mechanism. Every day we calculate those patients, outpatients, as well as the patients under observation. The latest update, that is today, we haven't got today's update. By tonight, we may collect all data to reflect the 24 hours change of the number of outpatients for fever clinic. According to yesterday's data, the total number for outpatients is 220,865 patients, which is 16,710 patients less. That is the 7% lower. So according to our monitoring at the national level, for fever clinic outpatients, number has been decreased. In terms of the new under observation, the number is 10,340. Those are under observation, which means that the doctors feel suspicious about their patient, about their symptoms. They want to put them under observation. We still have 32,540 are still under the observation condition, meaning more than 30,000 people are still under observation. Probably those under observation patients will become suspected cases and then confirm the case. In Wuhan, for the daily outpatients for totaled 12,000. That is the 56 more than yesterday. In terms of the fever clinic outpatients number, the absolute number is increasing, but the increasing rate is slowing down. In terms of the new under observation patients number, 192, four patients less than that of yesterday. So, you see, according to the number collected from the fever clinic, and the load in a gradual or step-by-step manner is lower. And now the medical resources basically can meet the demands of the patients, but still in Wuhan and other surrounding areas, they have high demand, so the load is very heavy. And also, in the wintertime, we do have a lot of other types of the respiratory disease. So to translate your question, you want to have this ideal situation. Anyone who gets the disease, they are supposed to be accepted by the hospital. Yes, but in Wuhan, it's very difficult due to the shortage of the bed resources in the hospital. So now we try to enlarge the supply of the beds or in the wards. And we have the deployment mechanism for daily medical resources, meaning on the day, how many beds you can make available to the patients, what is the gap, what is the shortage, and on the day, how many doctors are available, how many nurses are available. Those are medical resources, and we also need to understand the shortage and the gap. And according to our observation, we still have a huge gap in terms of the beds needed. In terms of the doctor and nurses resources, they are almost they almost meet the demands of the patients. And now we try to increase the supply of the beds for the patients. We also try to increase beds in those designated hospitals. You may also notice that we have the Huoshenshan Hospital, which is in use, and later we have the Leishenshan Hospital. Another one is going to be put into use. With all these newly built hospitals, we'll have more beds available. And also you may notice a news in Hubei and Wuhan City. They try to acquire some public houses or the venues to receive those mild case patients. And for example, stadium or exhibition center, those are public area and facilities. So we try to support Wuhan City. This is quite significant. It's like we try to bring all those infectious patients in a centralized manner for a centralized treatment, which can reduce the risk of spreading of the disease. However, when you try to centralize the patients into one area, actually they may have huge demands for medical resources, and therefore there might be some gap between the demand and the supply. So from yesterday on in Hubei, Wuhan City, we take this centralization manner, and yesterday we try to deploy more medical resources and contingency resources. We have in local hospitals, we call that third-party hospitals. Totally, there is the 20. We call that Fangcang Hospital. So with today, they will travel. They are mobile hospital. They will actually they're transported into Wuhan and try to support those centralized patients. And we have more than 600 doctors from those mobile hospitals to support Wuhan. And we also deployed more than 1,400 nurses to Wuhan City to support the prevention and treatment of the disease. And also China CDC and China Academy of Medical Sciences and Guangdong CDC, we deploy 3 mobile P3 lab for those suspected cases and mild cases. And through these P3 labs, nowadays they are allocated in 3 regions. With those, the Fangcang Hospital or a mobile hospital and mobile P3 lab, they will support the venue with centralized patients and doctors. They're responsible for the testing and the diagnostic of those patients. We hope that through this integrated measure, we can support those patients. Whenever they get this disease or infected, they can be accepted by the hospital. Thank you. Okay, this lady from the first row, please. From China Daily. With the released data, we have more than 2,700 severe cases. There are 8 people. So focusing on the severe patients, what are the major measures? What are the results? What about the effects of those measures? Mr. Li Xinwang, please. Actually, this is a virus-based disease. The most effective way is to kill the virus. But currently, we have no effective antivirus drug to kill that virus. And for the majority of the virus-based diseases, we cannot find the most effective weapons to kill the virus. So we have to have other measures, for example, symptom-based or symptom-focused. So if you are the what we call general patients, you need to be cured by yourself. Good rest, good food, and then you can be cured. But for those severe disease patients, we need to give them the, for example, breathing support or other supports. So we need to have this centralized reception of those patients.